Hi Deborah, it's Dr. Buford. We're just getting started on your left shoulder here. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. We're going to start off just looking here at the biceps. And this is actually pretty good news. See a little bit of tearing here in the labrum, but the actual anchor looks pretty solid. Got it? And we're going to put in our shaver here and smooth out this little area in the labrum. We can do this pretty quickly. That looks pretty good. And so as we look up at the biceps and tug on it, I really don't see any significant problems there, so I'm happy with that. It may turn out that this is just some impingement that's been going on, which would be the best option, and not having to fix the rotator cuff. So here we are with the capsular insertion into the humerus. That looks good. This is in the back of the shoulder. Posterior labrum looks good. Humeral head looks good. Everything looks nice and smooth. I don't see any significant arthritis. We'll save the cuff for last. And look down the front and see a little bit of redness here, but you weren't stiff on examination. So no frozen shoulder. And then as we look over here, we get a good look at the undersurface of the cuff, which is right up here. And this looks great. I'm actually very encouraged by the way that looks. That's a normal insertion of the rotator cuff. See how the fibers insert right at the edge of the articular cartilage. So I'm happy with that. So I think we're pretty much done inside the joint. We'll take another look around just to make sure we haven't missed anything, but at least on first glance, I don't see anything significant here to worry about. Possibly. All right, that's my second one. Okay, I just wanted to show you, we're in the subacromial space, and you do have a lot of inflammation up here. More than normal even for somebody who has a problem with impingement. So more than likely this is at least one source of your shoulder issue. I just wanted to show you how it looks before we clear out all this tissue. Okay, we'll keep working on show you some more in a little bit. Okay, Deborah, so here's the little bone spur at the, I shouldn't say little, it's bone spur at the front of the shoulder. This is it hanging down here. We've already worked back here to smooth out the acromion, which is basically the roof of the shoulder. And that looks good. This part of the acromion here is what we're going to remove at the front to make sure it doesn't pinch on the rotator cuff. We've got it here. Okay, so we're done with the acromion. We've got it nice and smoothed out, and now what we're going to do is show you the rotator cuff. Hold the camera there for a minute. I'm going to put the shaver in. And rotator cuff's down below here. This is the anterior portion of the cuff below my shaver. Can you hold the camera for a second? And we're just going to rotate the shoulder. Look way up over here. That looks pretty good, and as we rotate slowly, look over here, way louder, yeah. This is the posterior aspect of the cuff below here, and this all looks good. So as we go back and forth, we can see that that rotator cuff is intact. So the final verdict is a lot of subacromial bursitis. You can see how much more open this space is now compared to when we started. You had a bone spur that we removed, and I think that is all we have to do to hopefully get you on the road to recovery here. So we're going to finish up and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.